Hello, my name is Brian Lewis. I'm an instructor at JTNS, and in today's presentation we're going to talk about summer heat and hazards. But before we get started, I'd like to take an opportunity and ask you to pause the video. After you pause the video, discuss any near misses or accidents you've had since our last safety meeting. After you've had a good discussion, come to some resolutions and anything you need to do differently to keep near misses and accidents happening, then go ahead and press play and we'll continue our video, Summer Heat Hazards. Alright, hopefully you've had a good discussion and you've got anything taken care of that you need to take care of. So we're going to go ahead and get started with our presentation. So talking about summer heat and hazards, some things we want to talk about include heat stress, exposure to ultraviolet light or sunlight, bites and stings from the critters that we particularly encounter in the summertime, and any kind of poisonous plants. There's a video usually associated with this training. Due to technological limitations, we can't show it, but you can go to OSHA.gov and find it. So let's look at heat stress. Who is vulnerable? Who's at risk? Any individuals who work in hot environments, that's utility workers. The more intense and strenuous the workloads put an individual at greater risk. So the people doing the work, physical labor, wearing personal protective equipment, gloves, sleeves, chaps, respirators, hard hats, all the stuff that you normally wear and doing your work, your duties, is going to add some heat, right? Going to trap that heat next to your body. So some other factors: temperature, humidity, radiant heat, wind speed. There again, temperature is pretty self-explanatory. Humidity is going to add to the situation. When we talk about radiant heat, we're talking about heat coming off of blacktop. We're talking about heat coming off exhaust and engines, any kind of heat exchanger, things like that, things that radiate heat on you besides the sun and just the air temperature, the ambient temperature. When we talk about wind speed, nice breeze is hard to beat, especially in the summertime. But if the wind isn't moving, there's no air moving around you, it's going to make life a little bit more oppressive as far as the heat and humidity go. Some personal factors: well, just the older you are, the heavier you are, as well as your general state of fitness is going to come into being. People that take blood pressure medicine, people that drink abnormal amounts of caffeine, coffee or energy drinks or anything like that, people who consume large amounts of alcohol, and people who are not acclimatized. In other words, they're not used to working in the heat, and that causes some issues. So just be aware. HIPAA prevents your employer from talking about people's medical conditions. That doesn't mean that you can't talk among yourselves, the people on your crew, and make sure people understand if somebody there is diabetic, has heart problems, other things like that that you can help each other out with. Work factors: location, equipment power sources, how much you're actually having to physically exert, and safety equipment all play a part. So the body's response to heat: well, as skin temperature increases, it allows the body to give off excess heat. This is why your skin turns red. Your blood, your circulatory system, plays a big part in allowing heat to escape the internal part of your body. So that's why a lot of times when people are really hot, their face turns red, it turns flush, and that's what's happening. The blood is leaving some of the core areas inside your body, and they're moving to your skin to try and alleviate some of that internal body temperature. So keep that in mind. That's why people's face turn red. Some other things that happen is you sweat. This is your body's way of reducing its internal body temperature. So your circulatory system moves blood towards the skin so it can transport heat away, and then your skin sweats, and the evaporation of that sweat, or that sweat on your skin, helps reduce heat. That's just your body's natural mechanism. And you can sweat an awful lot of water out. An awful lot of water out. So some things about heat disorders that you want to pay attention to that give you an idea that you're getting a little too much heat, or that your body cannot reduce the amount of heat you're generating, is a heat rash. Your skin gets red and sweat ducts get plugged. It gets inflamed. It's itchy, and it's just not a pleasant thing. Heat cramps. Typically, these occur in the legs or the abdomen, but they can occur in your arms also. So if you sweat too much, what happens is you lose electrolytes, and as you lose electrolytes, what happens then is your muscles begin to tense up and you get cramps. So you want to avoid that. If you start having cramps, this is the first sign that you've got some issues that you need to take care of. You need to start sipping some water and find a cool place and let your body cool down. This is a big deal, and if you take care of this on the front end, hopefully you won't move into heat exhaustion or some other kind of heat-related illness, right? So heat exhaustion is just a mild form of shock. It's when you can't give off the excessive heat. Your body can't do it. It's not an immediate threat to life, but if it's not treated, it goes into heat stroke, and heat stroke's fatal, can be very fatal. So what happens in heat stroke is your body stops sweating. People typically have some kind of a mental deal there where they're disoriented and they have a hard time communicating clearly, and so you need medical attention. You need to call 911, and you need to get those people medical help as quickly as possible if they get into heat stroke. So keep that in mind. Heat exhaustion, the skin is clammy and moist, people are weak, they're fatigued, they're nauseated. You have to be careful with stuff like this, and be careful because your first instinct is going to be to give them water, but before you give anyone water, you have to evaluate them, make sure they're capable of swallowing, right? If someone's disoriented and they cannot swallow, you do not want to give them water. This is why you need the medical professionals there to start IVs. So you can't leave the person alone. You want to move them to a cool place. If they're able to drink water, Pedialyte, Gatorade, Powerade, any of the things that people need to replace electrolytes, that's what you want to do. Treat for shock. If people are unconscious, obviously, you want to put them in a resting position, and make sure that you get the medical attention there as quickly as you can. It's really important to get a medical attention when somebody is in heat exhaustion or heat stroke. Keep that in mind. So, heat stroke, as we've said, they stop sweating. People have a rapid pulse, hot, dry skin, and you can die really quick. So, call 911, get them to the hospital as quickly as you can. So, heat index. So, as we talked about in the previous slide, it's not just what the weatherman or weatherwoman says the temperature outside is. A lot of times they'll say the temperature is this, however, it's going to feel like this. And that's what we're talking about, heat index. And to be honest, in utility work, we cannot stop there because a lot of times we're going to be working around blacktop. We're going to be working around equipment, and there's going to be heat off that exhaust, the manifolds, as well as the blacktop. So all of these things combine to increase your risk level. So we need to be aware of those, Some prevention methods. It usually takes 2 or 3 weeks for someone to get used to a particular time of year in the heat. So pace yourself until you get used to it. Work in pairs. make sure you rotate workers and make sure people don't kill themselves. Don't let one person just wear themselves out. Drink plenty of cool water. And if you feel like you are having some issues as far as electrolytes, because you can flush all of your electrolytes out, or a great deal of them, so I would encourage you to look at electrolyte replacement. Things like Pedialyte, things like Gatorade, things like Powerade, Quench, all these things. Make sure you get something that's going to help you out there, and mix those with water. A lot of times, just nice, cool water is really good. It's really a good thing to get into your body, right? Now, us humans have a delayed thirst mechanism. So if you wait till you're thirsty, you're probably already dehydrated. So take a small drink every 15 to 20 minutes. There's no need to make yourself sick in consuming too much water at one time. But you do need to replace water as you sweat it out. Do not wait till you get thirsty. Go ahead and address the situation. You want to avoid coffee, soft drinks, alcohol. I'm not trying to be preachy, but all these things dehydrate you. So be aware of that. Take care of yourself. Prehydrate, right? Prehydrate. That's a big deal. So some other prevention methods: spend as little time as possible in direct sunlight. Now, I know that's not always possible, but you can make an attempt. Take frequent breaks in shaded areas if you can. Loose, light-fitting clothing is great. Rotate people in and out. We've already talked about that some. And I know it's not always possible to plan your work day. You're going to deal with urgent situations and emergency situations. But if there is anything you can plan for a cool or cooler part of the day, it's a good way to avoid excessive heat. So keep that in mind. If you can at all plan any jobs in a cooler part of the day, go ahead and do that. So let's look at ultraviolet exposure or exposure to sunlight. If you work in direct sunlight, which utility workers work in direct sunlight, you have greater risk. If you've had any problems with sun damage, you are at greater risk. If you are or have light hair, eyes, fair skin, you are at greater risk. People who freckle and burn, do not tan, they're at greater risk. Believe it or not, even people who live in higher elevations are at great risk. So, outdoor workers get 8 times more ultraviolet radiation through sunlight than people who work indoors, have a 60% greater risk of skin cancer. We're talking about melanoma and other skin cancers. At higher risk for non-melanoma skin cancers, and indoor workers overexposed to UV radiation at higher risk for melanoma. So over-the-road drivers, delivery drivers, everybody who drives a lot during the workday, they're at risk. You can go on the internet and look at some of these over-the-road drivers who have driven with their driver's side window down, and you can see the left side of their face is somewhat weathered by the ultraviolet radiation from sunlight, and the right side of their face looks normal. So you, like I said, just go use the search engine of your choice and look that stuff up, and you can see it for yourself. Over a lifetime, it does add up. So keep that in mind. We want to avoid that kind of thing if we can avoid it. So some steps you can take to avoid sun damage: stay in the shade as much as you can. Don't be tricked into thinking that clouds give you cover. They don't. Use sunscreen. It says here use SPF 15 or more, but if you can, use water sweat resistant. I would encourage you to go 40 or 50 is the SPF. Make sure you get the sunscreen applied as often as the package or the directions say on the package. Apply it, reapply it as often as the label instructs you to do it. Wear a hat. Wear a brim on your hard hat. Keep your neck, ears, eyes all shaded. Wear a cap. Protect your ears with sunscreen or some other kind of cover. Wear sunglasses. Keep your eyes protected. No one really wants to have any kind of surgery on their eyes. No one wants to have replacement surgery as far as the lenses or from cataracts in your eyes. You want to avoid that. So we don't talk about that an awful lot when we talk about ultraviolet radiation, but it's important to protect your eyes as much as possible. So fortunately, we're in a time and place in history where safety glasses are shaded and offer good protection to our eyes from sunlight, as well as impact from various things that could fly back and hit us in our eyes. So that's great. Cover up as much as possible. Wear loose, light-fitting, long-sleeve shirts. If you can, as light as possible. Try to wear a t-shirt or something else like that. Avoid artificial tanning if you can avoid it, right? Avoid all that stuff. So, check for signs of skin cancer. Now, this is something that we can do. If you notice something on a coworker that looks like any of these pictures, bring it up to them. Talk to your wife, your girlfriend, your children. If they notice something on you, or you notice something on them, don't waste time. Get to a physician, have them look at it. It's important that we catch any cancer early, and the earlier you catch it, the better off you're going to be. So let's talk about the varmints that bite and sting us, right? Poisonous plants. Excuse me. So if you work around any kind of structures, material, you know, the varmints are going to find a place to hide. Any kind of remote or seldom used vaults or cabinets or any kind of remote locations, and especially in people who work in wooded or landscaped areas. Keep that in mind. Of course, you can get stings from wasps, bees, hornets. All these pests have some wasp killer with you. I would encourage you to have that. Pay attention for any kind of nest that you may see. Bites from ticks, chiggers, ants, all these kind of things are just pests, and they drive us crazy. And of course, spiders. Even stings from scorpions are not pleasant, right? Especially here in Tennessee. May not be the size scorpions you see in the movies and other parts of the world, but they're still not pleasant. So keep those things in mind and look out for them, right? So how do we avoid these hazards? Well, put repellent on, wear good boots, wear long sleeve shirts, tuck your pant legs into your socks or boots, wear light colored clothing. Inspect yourself carefully. Shower immediately after coming indoors. Do yourself a favor. When you shampoo your head, leave your shampoo in your hair for a while, a couple of minutes. Lather up with soap. Leave it on your body for a while. Do that sort of thing, and a lot of times ticks will let go. Because you have left the shampoo in your hair, or you have lathered up with soap and left it on your body for a minute or two. So keep that in mind. Spray your pets at home. Avoid surprises and blind spots. Pay attention to where you walk. Pay attention to where you put your hand. That's an important thing. So how do we treat bites and stings? Well, you want to use tweezers on tick bites. Use antiseptic, clean wherever the tick has been. For bee and wasp stings, remove the stinger, put a cold pack, reduce the swelling, use some kind of antiseptic. If you have an allergic reaction or a history of allergic reaction, talk to your doctor, get you an EpiPen, things like that. Anything that will reduce anaphylactic shock. If you're allergic to stings from wasps, bees, etc., make sure you have that available. Now for snake bites, spider bites, you want to wash the site, you want to keep it clean. If it's a poisonous snake, seek out medical attention. Okay. Now, I would encourage people not to kill black snakes and king black snakes. They tend to do us people favors in controlling field mice and other varmints, including poisonous snakes. So I'd encourage you not to kill those snakes. Try to relocate the snakes if you can. Okay, try to relocate them if you can. If somebody gets bit by a poisonous snake, seek out medical attention. Go get somebody to help you out with that deal. Now, when you talk about poisonous plants, I'm sure other people have heard this before, but leaves of 3 leave B. Leaves of 3 leave B. If you know you're allergic, be particularly attentive to what's going on there and where you're using your tools, your hands, and where you're walking and things like that. So keep that in mind. I would encourage you, most of these substances that are poisonous are oily based toxins or oily based poisons. So what I would encourage you to do is have some kind of dishwashing soap available to you, and if you get into a patch of poison ivy, poison oak, poison sumac, use that dishwashing liquid, which removes grease, right? So it removes an oily substance from your dishes. Use that to clean your hands, your forearms, any kind of equipment, and get that substance off there, because it tends to be sticky and stay around for a little while. And if you can do that and remove that oil from yourself and from your tools and clothes, you'll be much better off. Wash all the exposed areas, as we just talked about, wherever you can get some water, wherever you can get some detergent. Like I said, use a detergent or a dishwashing cleaner that's specifically to get oil and grease off of stuff. Wash your clothing. If you do something like you get it anyway, and then calamine lotion, there's all kinds of things you can get to help you with that. If you ingest or inhale, say you burn and brush or something like that, you get it in your eyes, your nose, your throat, your lungs, you need to get to the doctor. You need to get to a medical help as quick as you can. You don't want those blisters setting up in your eyes, your throat, your nose, your lung, your airway. You don't want anything to obstruct your airway, right? And so a lot of times we think about airway obstruction, we think about food, or we think about other things like that, but we can encounter some toxins, some poisons that will cause our body to get inflamed in those areas, and we want to avoid that also. So some of the main points we'd like to review is the summer season has many unique hazards, including heat stress, ultraviolet radiation from the sun because we're outside more, insect bites, stings, poisonous plants, all kinds of varmints and things we need to look out for. So pay attention to where you step, pay attention to where you reach with your hands. You can protect yourself from heat stress type illnesses by taking a few more breaks, especially till you get acclimatized or used to the heat. Drink plenty of fluids. There again, drink water, drink some Pedialyte, Gatorade, Powerade, any of those things, Quench, any of those things that help replace electrolytes. Try to avoid the foods and drinks that cause you to lose water, that deplete water in your system. You can protect yourself from the ultraviolet radiation by covering yourself up and using sunscreen. Just some common sense kind of things, right? Avoid bites and stings using repellent, knowing where you're at, knowing where you're stepping, knowing where you're reaching to, trying to avoid disturbing things, right? Recognize poisonous plants and avoid contact with them. So, I absolutely appreciate you all paying attention and to this program. I appreciate any kind of feedback that you may have. As always, any of your JTNS instructors are available to answer questions and help in any way possible. So if you have any questions, you have any comments you'd like to make about the presentation, please get in contact with your JTNS instructor. If we can answer your question right then, we'll be happy to do it. If we can't, we'll do the best we can and research and get you an answer. So I appreciate your time once again. Have a great time, great day, great work day, and we'll see you in the future. Thank you.